About sleep. We want to welcome everyone to our webinar called Pillow Talk, Better Sleep for Better Health. We're really excited to present this information, and this is information that we've seen help hundreds and hundreds of people in our practice, and it's really exciting information for us because we've seen the changes that it makes in people's lives and the positive things that have come from this in the past. So we're hopeful that it's a blessing to everybody that's watching live and everybody that's watching the replay, because it really can be life-changing information, and we've seen that firsthand. So thanks everybody for making the time, taking the time to join us. For those that are eating dinner, eat dinner and enjoy it, and we will catch you as you finish up. But anyway, thank you everybody for coming on. We want to introduce our speakers tonight. We have Karen Harina. Karen is an amazing wellness coach. She is the leader of our Thrive, our Bodyworks Thrive wellness coaching program. Just does an amazing job. We're so happy to have her on our team, and I've learned so much from her just simply by doing our conversations and videos and things like that together. And then we have Dr. Damian Heiser, Doctor of Physical Therapy and pain specialist, who's going to be speaking as well. And Dr. Damian specializes in helping people with chronic pain, and with chronic pain, oftentimes we see sleep as a factor of that. And if we can help with the sleep issues, we frequently see that we see improvement in pain. So very excited to have both of you on board with us. And without further ado, we'll pass the baton to you and let you get started.
Perfect.
Okay. All right. Welcome, everybody. We are so glad to be presenting this webinar to you guys. We see this probably every day, if not several times a day, people having trouble sleeping, either due to pain or other issues. And we thought that it would be very important and a very good service to all of you to present this webinar, just to give you some hope for one thing, and to give you some information that you can take going forward. So without further ado, let me share our screen here. And feel free, we're going to have a chance for you guys to comment in the chat box several times. So get your typing fingers ready so that we can have some interaction here. So we're going to share a screen with you. And we've got a PowerPoint here. So the PowerPoint is entitled Better Sleep for Better Health. And, you know, one of the questions that we want to ask is, why is sleep such a big deal? Why is it something that is in one of the pillars of health, as far as it's right up there with nutrition and activity and stress relief and better relationships and healthy habits? And why is that? Partly because it's so healing. And the other reasons are, you know, since the onset of, or the discovery of electricity, our ancestors really slept about 90 minutes more than we are right now. And that's on the average. So we are losing sleep just because of, you know, modern technology. And as our technology gets more, we sleep less, because now we have all of those gadgets that we like to have in bed with us. So also, I think for some of us, society has been kind of a detriment to our sleep, because, you know, now being able to function on a small amount of sleep is considered brave or strong, and requiring sleep is kind of like, you know, a weakness almost for some people. However, that is not the way it should be, because we are really meant to sleep a certain amount of hours. And so, you know, a lot of times we think that early morning or late evening is the best time to get things done. But you're going to see tonight that maybe that's not the case. And really, 1 in 3 people are having trouble sleeping at some time in their life. And that's not just when you're up with a new baby, that is other times of your life as well. So as a quick collaboration, if you could write in the chat box, what would a good night's sleep do for you? What is something that a need that would be met if you got a good night's sleep? Anyone want to share? Oh, we have one here. Wake up less tired. Yes, definitely. Anyone else want to share? What would a good night's sleep do for you?
More mental energy throughout the day. Yes.
Mm-hmm.
Oh yeah.
Mm-hmm. I'll give you a few minutes. If you're driving, don't type.
See if we can maybe get one more person to let us know how that could be helpful.
We got one that says, have more energy and focus.
Yeah.
More energy and focus. Excellent.
Perfect.
Good. Okay, well, we're going to cover that. So let's see here. How did we do? Oh, I have to get that off. Okay. Okay, what if you could do one thing for yourself? Now, we all think about more energy, increased focus, feeling better. But did you know that sleeping better could help you lose weight? Improving your mood. It could reduce your risk for heart disease and Alzheimer's. It will improve your creativity and help you heal. So those are added bonuses besides just the things that we think are more obvious, like having more energy. Okay, so the big top 10 of functions of sleep. Sleep helps us restore. It cools our brain, it cools our body. Our body temperature actually drops during our sleep time, and that is anti-inflammatory. That's farther down the list, but that is anti-inflammatory. It helps us reset our whole body because ion channels are in every cell of our body. It helps us repair. Physiologically, our bodies repair during sleep. It's anti-inflammatory and it reduces every inflammatory marker. It improves our mood. It's good for heart health. It is cardioprotective to get a good night's sleep. It improves our brain health. It improves our memory. It improves our joy. It improves our energy. We talked about energy. Lots of people think about that energy, that physical energy. So you guys we did pretty good, I guess, on figuring out what a good night's sleep would do.
Definitely.
Okay. So the question now, if you want to respond in the chat box or just say, is it quality or is it quantity? Which one is more important for sleep? Anybody want to take a stab?
Yeah. No.
I don't know how to. I'm not able to write to participate by writing. Somehow I can't figure it out. But
That's
quality.
Quality.
Quality is yours. Yeah, you can pipe in if you want to. If you don't want
to. I don't know how to figure it out. I'm sorry.
Oh, that's
okay. No worries.
There's a pencil, but it doesn't bring me to somewhere where I can.
Oh, no, that's okay.
That's okay.
You're fine. You just pipe in if anytime.
Yep.
I'm going to say quality too, because I don't want to try to type while I'm driving.
Okay.
But if you're on your phone, there's a little 3 dots at the bottom right that you can get to the chat.
Oh, okay. Thank you.
That's what it looks like.
Yep.
Yeah.
So
Quality.
and it's more quality.
Okay.
Perfect.
All right. So you guys are right because it's both. We need quality and quantity. And I'm going to show you on this slide right here why it's quantity. Dr. Damien's going to get a little bit more into why it's quantity or quality. So this is quantity. We have a sleep cycle that all of us go through. It doesn't look like this all the time because we'll have waking times and we'll have times that we're just kind of restless. So, but what happens in the first half of our sleep cycle is that physical repair. Our bodies repair themselves during that first half. And you'll see here, if you'll look, that deep sleep is during that first half of our sleep cycle. Also, what's happening during that first half of our sleep cycle is our brains are repairing as well. So it's called declarative memory, or it's just filtering the data that happened to us during the day. It's like just the facts. It's like if you were writing out a Post-it note of everything that happened to you during the day, and you're just writing a Post-it note. That's what's happening the first half of the sleep cycle. The second half of our sleep cycle is that mental and emotional clearing, that mental repair and emotional repair. So we're taking those Post-it notes and we're problem solving through them. We're arranging them in something that makes sense. Sometimes that's our REM is when that's happening. That's our dreams. That's how we emotionally clear some of those things that are happening to us. So that's why it's quantity, because we need both halves to have physical healing. Okay, so we have a rhythm. It's called a circadian rhythm or a day-night rhythm. So how we function during the day affects our night, and how we sleep at night affects our day. And so this little graphic, let's pretend, or let's just assume that we're going to wake up at about 6 a.m. So that's over there on like the right-hand side. So if we get up at 6 a.m., at 6:45, we have our sharpest rise in blood pressure, because the cortisol, we have a cortisol spike, which is a hormone. Why do we have that? So that we'll eat breakfast. That's our sign to eat. Now remember cortisol and eating. So then at about 7:30, if we get up at 6, our melatonin secretion stops. So that's telling us, wake up, it's daytime, let's go. So then we have our best alertness, our best mental alertness, our best coordination happens about 2:30 in the afternoon. Our fastest reaction time is about 3:30. Our best muscle efficiency is about 5 p.m. We get a highest blood pressure about 6:30, partly because of eating and just what has happened during the day, because we've been up and around, hopefully. And then we have our highest body temperature is around 7. Okay, so what happens at 9 o'clock? Then our melatonin kicks in. We start melatonin secretion. What does that do? It tells us time to sleep in about an hour. So if we go to sleep about 10, wake up at 6, that's what your sleep schedule and your day-night rhythm would look like. So let's look at this. What are some things to make that more healthy? What can we do during the day? Well, get some sunlight, get out, open your blinds if you're inside, get some exercise, keep your naps short. If you nap, then keep them short. 10 to 20 minutes honestly is a good time. Avoid caffeine in the afternoon, avoid using electronics in bed, and then build a consistent sleep schedule or a sleep pattern for to wind down during the night. Okay, so here's a chance for you guys to respond. What does your day-night rhythm look like? You can either talk or type, either one.
Are you asking like in terms of our wake up and bedtime?
Yes,
Okay.
wake up, bedtime. What time do you eat? What time do you does it look like a pinball machine where you're where you're caffeining it up and then winding down or whatever? So what does it look like?
Yeah, Cody's saying he gets up at 6. He's in bed by 11, and he feels worse when he stays up later past that. Yeah.
Yeah.
Mine is I'm up by, depends on the day. I wake up to exercise, so I'm up typically like 5:30. Get up and I do my workout, my run. I'm in bed. Man, if I'm in bed by later than 10:30, I'm staying up late. That's a late night for me. I'm in bed typically before 10 myself, and I have my own little routine that I do as well. So that's pretty much the same every single night. I don't break it much.
Yeah.
Perfect. So we got a few people chiming in. Eleni says, up at 7:30, go to work, works out, eat dinner. In bed between 9:30 and 10, but she wakes up a lot throughout the night.
Okay.
Kate, wake up at 7:15. Coffee, yeah, there we go. I'm the same way, Kate. Breakfast around 8. Work out between 5 and 7. Bed by 11. Miriam, mine is really messed up. I dread sleeping because of daily, very frightening nightmares that haunt me during the day and come back at night. Okay, so
all right.
some,
Something to address.
yeah,
Yeah.
definitely so. So
Mhm.
great ideas, great insight there, everyone. Thanks so much for
Yeah,
sharing.
thank you. Okay, so what does disordered sleep look like, and what does it do to us? We have inflammation, we have metabolic issues, we have vascular issues, we have hormonal issues that can be those are the things that can cause some disordered sleep. Then our risk factors would be more like that hypertension or obesity, and it's spelled wrong, sorry, and diabetes and hyperlipidemia. Those are the risk factors. Now, what can be an outcome of that is heart disease, stroke, dementia, early death, all from disordered sleep. They all interact with each other, because if you have some inflammation that can disturb your sleep, but it also causes hypertension in your vessels. And so that leads to that heart disease. So that disordered sleep is something that's very important and something that we do need to address, because it can cause lasting changes to your body. Now, also on the good flip side is that getting better sleep can help you kind of heal those things. It can heal that inflammation. It can heal those. It can really heal your heart, because heart disease and disordered sleep go hand in hand.
Mhm.
All right. So what are some disruptors, arousals, and awakenings? Sleep apnea is a big one. Snoring. I think the statistic is only about 10% of people who have sleep apnea get treated for it. Very important for our heart health, and actually for our mental and emotional health. It's a contributor to dementia and actually cardiac arrest. So sleep apnea is a big thing to kind of get addressed. And usually it's your sleeping partner that lets you know. I'm actually, another job that I work at, I actually am down the hall from the respiratory therapist that does all the CPAP machines. So I learned a lot from them about sleep apnea. So periodic limb movements, which could be your restless leg syndrome, or it could be all of your limbs just moving. Teeth grinding, pain, big one. Any kind of medication, some of them are stimulants that can keep you awake. Steroids are a big one if you're having to take steroids for something. Mm-hmm. Caffeine, alcohol is a huge disruptor in our sleep. We think that glass of wine is helping us wind down. It's really not. It's keeping us awake for 3 more hours. Every drink equals 3 hours of no sleeping. So remember that. Room environment, whether it's too hot, too cold, too light, too chaotic, too noisy. Medical conditions can definitely disrupt our sleep. Depression and anxiety are a big one. Stress, we talked about nightmares, which can be related to some stressful situations and some trauma. Hormonal menopause is a big disruptor of sleep. Bladder issues, neurological issues, cardiovascular issues, autoimmune things, inflammatory things, all of those can be disruptors to your sleep. and need to be addressed. So what disrupts your sleep? Time for you to share. Okay, the pet in your bed can be your disruptor. Yep. Most of the things that we are taught about sleep is that, yep, your dog. Yeah, their sleep schedule is totally different than ours.
Yeah.
They sleep different. They can be in the room with you, but just probably not in bed with you.
Yeah, not that we want to call Sasha or Bella disruptor, Cody.
No, we would never do that. Anyone else?
I know for me personally, temperature is a big thing of
Yes.
sleep disruption.
For me, I have to have my animals around me when I sleep because of the nightmares. And when I wake up and they're there, then I know I'm back in the real world.
Yeah.
Otherwise I don't know, and it's so scary. I can't sleep unless at least one of them is right there where I can touch him.
Mhm.
Perfect.
Yeah, so they're probably more of a sleep helper. So definitely.
Yes.
Yeah.
Yeah. So Mulaney, medical and temperature.
Yes. Yeah. Medical issues are big. They really are. We can get that. If we can get our body to heal, it helps.
Yep.
Helps
for
our
sure.
sleep too. All right. So what are some things that happen to us when we are tired, sleep deprived? Well, a tired body is a depressed and anxious body. And we talked about that a little bit in the, when we were talking about the sleep schedule or the sleep patterns or this how we sleep at night, because it is healing. So a healthy sleep duration and quality lead to faster cognitive processing. You see that. I mean, you can definitely see that. Restoration of your mind and your body, anxiety and fear extinguishment. And that is, when we're putting all those Post-it notes together to kind of process things that have happened to us through the day, and enhanced learning and memory. So those things are just, direct results from a healthy sleep pattern. Okay, now a tired body is a hungry body. Sometimes we don't make this connection, but it is real. Our bodies, when we are tired, when we are sleep deprived, we are craving. Our cravings are give me sugar, give me fat, and give it to me now. And actually, one person that I worked with, an athlete that, was very, very health conscious, ran triathlons, did all of that. And when she started sleeping better, the first thing she noticed was that her sugar cravings were decreased. And she was amazed. And it will be noticeable. So healthy sleep duration and quality. We talked about that cortisol spike so that we'll eat. Well, if we are tired, that cortisol just stays up there. And so we're always hungry. So if we have a healthy sleep duration and quality, it's going to lower that cortisol level, and it lowers our glucose levels. It increases our insulin sensitivity so that what we do eat, we're processing better. And then it also produces higher levels of a chemical or hormone called leptin, which is our body's natural appetite suppressant. So just sleeping can help us with that. All right. So a tired body is also a mistake-prone body. Remember back, Damien, when you used to pull the all-nighter?
Days are long
Never
gone.
did.
There's David behind me.
Okay. When we pulled those all-nighters so that we could study, so that we could do better on the test, didn't work. Didn't work. Look at this chart. And if I don't want you to get all wrapped up in the dots and all that, but if you'll look at that very left-hand square, those squares that just go straight up, that is total sleep deprivation. That's if you stayed up all night That's how many lapses you're going to have in a day, attention lapses. And so then over a week's time, so then the rest of them are kind of like, okay, if you only had 4 hours of sleep nightly for a 2-week span of time, look at the mistakes that you're going to make in a day. After about 6 days, you're going to start making 10 mistakes. Now, I personally do not want my surgeon to be sleep deprived.
Mhm.
I don't want my car mechanic to be sleep deprived. I don't want the person who's making the plane that I fly on to be sleep deprived. Those are the things. I don't want you to be sleep deprived, honestly, because of the things that, just those attention lapses. And so look down there at a person that's getting 8 hours of sleep nightly, those diamonds at the bottom. After 14 hours, they're making some attention lapses, and this was based on a standardized test. And so they had to respond within a certain amount of time. That's basically what the attention lapse was. They're making 4 as opposed to 14. And so our sleep deprivation does accumulate. You can see that over time, but also over time, we lose our insight into how impaired we really are. So that does a double whammy. We also don't know that we're being so impaired. All right, so Dr. Damien is going to talk about his specific area of specialty is pain.
Yeah, so we wanted to give this its own kind of little section, its own little credence here. So I know it's really interesting. So any time a patient comes in with me for a new patient examination, whatever it may be, I'm always asking about sleep, because we're about to learn a little bit how intimately tied these two concepts are together, pain and sleep. Anyone who attended our chronic pain webinar a couple weeks ago got a little bit of a taste of this, but we're going to go into more depth here as to why this is so intimately connected. So the first thing I want to see, and yes, this is kind of a big graph here, but it's really important. And what I want everyone to pay attention to right now is at the very bottom of both these graphs where it says sleep, fairly good, fairly bad, and very bad. Those are the 3 things I need us to pay attention to. On the left-hand side, this is if I, as your physical therapist, went and asked you and said, hey, person X, we came in, how'd you sleep last night? And if you came in and you said, well, Damien, I slept 4 hours. And I said, okay, well, were you well rested from that 4 hours of sleep? If you come in and you tell me, nope, that was a terrible night of sleep, that was crummy, that wasn't very good. Well, guess what? Your prediction of having a pain flare up or having pain in general increases. As you can see, the numbers are off the charts there, guys. This is extremely predictive, not only the day of that you've had a poor night of sleep, but up to 3 days after here. And that's mainly you telling me that myself. Now, on the other side, this is saying the same exact thing. If we go in and you're telling us that, hey, I haven't been sleeping well, that night of sleep I'm getting, and this could be even if you're getting a full 8 hours of sleep, but you come in and tell me, and I ask you the question of, well, hey, do you wake up well rested from that 8 hours of sleep? And when you look at me and tell me, no, Damien, I don't, that's predictive of you having pain that day, the day after, and then the day after that. And if we're starting to throw this on top of one another, if we're having this effective culminations of nights where we're just not sleeping well, we can kind of maybe imagine here where if you come in and you have back pain from lifting something heavy one day, but this is kind of how you're sleeping at this point, we could see that weeks, months, years from now, that this still hangs around for you at this point. These people that they surveyed where these graphs come from are people who are dealing with chronic pain, which as a quick reminder, chronic pain for us in our world is if you've been having pain for over 3 months. That's what chronic pain is. So these people have had some sort of pain, it's typically back pain, for over 3 months, regardless of the amount of sleep they got. This is purely quality of sleep, everyone. It was extremely predictive of a pain flare up that day and 3 days after. Extremely predictive. It's almost eerie how we see that, you tell us that, and we say, man, that's not setting us up for success here. And Karen's already talked about this, guys. The abundance of things that happen while we're sleeping, the growth hormones, our proteins. If you go out and you have a muscle pump class, or you go on that hike with the family this summer in Colorado, and if we go out there and we're not sleeping very well, we're not recovering from that. We're not adapting to that stress at this point. And our brain, there's a map in our brain, everyone, that tells us how we move, what we feel, the structure of our brain, that improves, that changes while we're sleeping. It gets better. Adrenaline, the go hormones, if you will, those get shut off when we get a good night's sleep. We shut down that fight or flight system. And the most important thing, and really for me, when a patient comes in and we're dealing with something like this, we're dealing with chronic pain and we're trying to get back to the things that we want and love to do, getting that good night's sleep, even if it's 4 hours, 2 hours, whatever it is, if we get that quality night's rest, our brain and our body adapts to the stresses we went through, whether that's a physical stress, a mental stress, a spiritual stress, whatever that is for you, your body is adapting to it when we get to have some quality sleep here. And that's the beauty of this. And kind of like Karen has mentioned, the quantity here is important, but for me, I don't have people come in and they're like, oh, I'm sleeping 2 hours a night. I don't say, oh, we got to bump that to 8 right now. That's just not realistic for a lot of reasons. And so for me, it's, well, how do we make that 4 hours or that 6 hours of sleep as good as it can physically be for you? And that's what we focus on first here. I'll tell a quick story. I work, like Cody had mentioned earlier, I work with a lot of patients who hurt for a long time. And it's eerie how predictive this is, guys. When someone comes in and we've maybe been doing really well, we're getting out of pain a little bit, we're getting back to some activity, we're feeling good, and then we come in and we've blown up. Their pain is back, they're hurting again, and we're kind of thinking like, man, their first thought is, I lifted something too heavy, or I did something physically that's causing this. And that's when I start to go straight to this and say, well, hey, how have you slept this week? How has sleeping been the past couple of nights? When they start to tell me, well, the kids were doing this, or we had this event going on, I wasn't able to sleep very well, or we were out of town, the dots start to connect at that point. And the beauty there is making that connection with that patient of, hey, I don't think our physical activity was the problem here. I think the most important supplement we can take is sleep, and we miss that over these past few days here. So the bottom line with this, everyone, improving our sleep quality is going to directly affect the overall health of our mind and body. It's going to directly decrease our susceptibility to pain. Pain is something we experience as human beings. It's something we can't necessarily avoid, but man, if we're at least sleeping quality wise here, we're less susceptible. And worst case scenario, it's protective for us. It's protective against pain. It's protective against injury. Being able to have good sleep quality will set the stage, allow us to begin to improve the quantity at that point. And the bottom line here really is, we want to make the most out of the sleep that you're already getting. And if it's possible, start to bump that number up over time. An example of kind of how I tend to do this with some patients is I use this form right here. I know it kind of looks like that clickbaity Google, here's 13 quick fixes to this. But the way that I use this with patients is we use this as a sleep journal. We go through, we talk about each one of these points here, and we identify maybe 1 or 2 areas that we can work on. And maybe it's something as simple as, hey, you're someone who's on TikTok, you're on Instagram, you're on Twitter, right up until before your head hits the pillow, let's maybe put the phone down 5 or 10 minutes before bed at this point. And let's start building on that. So, that's how pain relates to our sleeping here. It's very, very intimate. It's very connected. And it's one of the interventions, one of the treatments that I'm very, very biased and heavy on working with patients on in order to get us out of pain and starting to improve some things there. So.
And that's something I've noticed with working with Dr. Damien with some of the clients that we share, is that he is very involved in their sleep. And I think that's just a great pattern. And that's why it is quantity and it's quality as well, because, you can see all of the evidence right there of why it affects your pain level. So time for you to post again or talk. If you could improve one area of your sleep, what would it be? And you can put anything.
If I could just stop having the nightmares, I've been wondering for the longest time how I can. I don't know when the REM periods start, but if I could put my alarm to wake me up before I go into dream, and because this is a really big issue for me that I've had all my life.
Mhm.
And all those things you've been talking about, the side effect or the consequences are extreme with me right now. And I don't even know how to deal with it, where to go. And if at least I could get rid of the nightmares, and I don't even understand what that REM period is for, because it's not benefiting me. I wish I could, if I knew exactly when it starts, I'd wake myself up every time it starts just to stop it.
Mhm. Yeah, it's like it's a little bit short circuited there. So yeah, I hear you there.
Couple of chats here. Kate's talking about restlessness. They're in bed. Frankie, fall asleep faster. That's a
Mhm.
really, really common thing that I see with a lot of patients where we're laying in bed 30, 45 minutes before we fall asleep.
Mhm.
Really, really common problem for a lot of people. Cody not falling asleep during the ball game, and then waking up at midnight, then going to bed. So kind of having some interruption there. And
Mhm.
Eleni talking about stop waking up during the night, getting a full night's rest would be incredible. Yeah. And yeah, Kate's talk, she uses
Okay.
an Aura ring here. So using something to track her sleep here, and how that shows that, hey, we're having some restlessness at this point. We're having not potentially the most optimal night of rest.
Mhm. Those are all really good responses, and we can kind of relate to all of those and see an area that would be an area of improvement. So those are all great responses. So what is next? I think if we can make that connection just between sleep and health, and I hope we helped this evening to kind of help you start to make that connection. Sometimes, we don't understand really what sleep does for us. And, we think, gosh, I can function on 4 hours of sleep and be fine. And you can for a little while, but not very long.
Yeah, we're not thriving at that point.
We're not.
Yeah.
No. And then maybe start to build a few healthy habits into your day that will determine how well you sleep at night. And then an opportunity that we have here at Bodyworks is coaching and connection with a group to get on track to a better night's sleep. And just to segue into that is our next session of our group coaching for sleep is going to start like the first part of October. And so it's a very small, intimate group that is going to be like around a 30-minute per week commitment. It is an educational Zoom session, and then it's a little bit of some practical homework for you to do in the meantime in the week between to put into practice. We're limiting this next session to about 6 to 8 people. So please be thinking about that as something that would be a possibility for you. We also have Dr. Damien, who is working with if you have chronic pain, subacute pain where you've maybe injured something and you're still having some trouble with that. He's definitely the available and the person to contact for that. And then there's also one-on-one coaching that we offer as well. So there's several different options that we can look at to as far as what's next, what's after, what do we do after this. So are there any questions at this point?
Yeah, and even before
Okay,
we go right into that too. Something that Cody's posting it in the chat right now, talking about a sleep survey here. So this is definitely for anyone who is potentially interested in working with Karen, working with us through this program here. This is a quick survey. It takes less than 60 seconds. We're kind of thinking of it almost as an application of, hey, if you're interested in this, we want you to fill this out. That way and send that back to us. That way we can kind of contact you, get a little bit more information, really ensure that, hey, are we a right fit for this? Or is there potentially another avenue that we can go down here in order to work with you on this? Because, you know, like we've seen, man, this is really important for a lot of different things. And like Karen said, 1 in 3 people are affected by this, or suffer from having poor sleep. And, you know, if we're going to throw out a statistic about chronic pain, 1 in 4 people who go on to who have any sort of injury go on to develop a chronic pain condition. Those numbers are pretty intimately tied, in my opinion, in my correlation here, team. So if this even smells like you or looks like you would all, hey, take advantage of this opportunity here, because we'd love to help.
Definitely.
So, but with that said, you know, what questions, thoughts, comments, concerns do we have as a group here?
Right. You can throw them out or you can put them in the chat box, either one.
Yes.
So whatever you choose.
That group that is starting soon, that is limited. What is the cost of it, and is it over Zoom, or do we have to go there physically? I'm asking because I have a transportation problem.
Okay.
Sure.
Okay. That's a very good question. You know, it varies. I would love to visit with you. I mean, if you fill out the application, then I can contact you. It'll be a 5 or 10 minute phone conversation, and the meetings will be over Zoom because
Okay.
we're opening, you know, it's 6 to 8 people, but you can be anywhere, and it's in the comfort of your own home. So,
Okay.
yes.
What tips would you give for falling asleep faster?
What tips to
Mhm.
fall asleep faster? Well, you know, I hate to give too many just like right off the top of my head. There are some things that you can do as far as, you know, it's kind of like your daytime routine affects your nighttime routine. And so what you do during the day, like when you drink, what you drink, how much hydration you have, when you eat, what you eat. There are lots of things. When you kind of wind down, because when you start in the morning, when do you see the first sunlight? Those are just things that kind of affect that. So there's lots of things that are intertwined in there. One of the sessions that we're going to do in the group is that I'm pretty kind of excited about that we've done for our session is how to beat daylight savings times. So you remember how like when we fall back or spring forward, how like that first week is just really rough?
Horrible.
Yes, it is. We're gonna hack that. And I'm pretty excited because I think I'm just gonna time that session for the week before daylight savings time. So we can we're gonna be the only ones that are like thriving during that. So that's a great question though, Avid, because that is something that a lot of us struggle with.
And that's definitely the beauty of what we got in the chat box too, Avid, to help us kind of help you a little bit more by getting to know a little bit more about your specific struggles with that here.
Yeah.
This is Kate. Do you have any recommendations on pillows? I kind of thought from the image that was in the advertisement for this session that you might be talking about pillows because it's called Pillow Talk.
Oh, well, Dr. Damien can talk about pillows.
Yeah.
Okay.
Yeah. It's funny. So that pillow you see in the advertisement, that's one that we carry here in our clinic. We get them out of the Netherlands. They're very, very much top of the line. They're actually individually fit for you as well. We're pretty partial to them. And we use them in all of our treatment rooms too. And a lot of patients get partial to them. So there definitely is a time and a place for that, Kate. You know, if that's something that you're interested in checking out or learning more about, you know, that's definitely a time for us to maybe have a conversation, whether it's over the phone or just even getting you into the clinic, talking a little bit more there, and even seeing if we can fit you for a pillow here and seeing what your thoughts are on that. But, you know, these are ones that get fit specifically for you, for your neck, for your head.
That's cool. Okay, thank you.
Yeah, my pleasure.
Yeah.
Okay, everybody put in the chat at least one thing that what was one good takeaway tonight? Or what was the thing that made the most impact? Or
the connection
Yeah.
between sleep and pain. Yeah.
Yep.
It's interesting to connect those dots, isn't it? It really is just kind of eye-opening.
Yeah, connection between daytime, nighttime, daytime. Yeah,
Yeah.
that internal clock, as they call it, right?
Mhm.
And they call it a rhythm for a reason too.
Mhm.
Eleni, finding out how much sleep affects things just beyond, our focus, our energy, just kind of where we're at physically in the day, presence in the day, definitely.
Yeah, we noticed that. That's what we noticed. Like,
Mhm.
oh, I know I didn't sleep well last night, so I'm tired today. But those other things that are going on behind the scenes, that we're ready. We're ready for a good night's sleep.
Yeah, it is fascinating, Kate. It's super, super interesting. Super interesting.
Yeah, one time, I think my physician, we were talking about the circadian rhythm, and when you wake up, one of the things your body tells you is you have to go to the bathroom. So when you wake up in the middle of the night, the next night, I'm like, you don't have to go to the bathroom, and I just went right back to sleep,
Yep.
and it was no problem. But if you don't know that, you get up, and then you have to like put yourself back to sleep, and yeah, it was amazing just learning that little bit of information. Yeah.
Kate, it's interesting. I have a patient that I'm working with now who one of his things with sleep is his body wakes him up to go to the bathroom. He gets up and he goes into the restroom, but he doesn't have to urinate. He doesn't have to use the restroom. It's just now like this very much learned response for him.
Mhm.
And he's had a really hard time trying to break it, because for him, trying to go back to sleep, just waking up and saying, no, you don't have to go back to sleep, it doesn't happen for him.
Mhm.
So there's definitely some disruption of that rhythm, that cycle for him that we're still kind of working through.
Mhm.
I use Cody, you'll appreciate this. I listen to a story on Calm, the app, and I love tennis. I love playing tennis, watching tennis, volunteering, and I listen to John McEnroe read the rules of tennis, and I know I've never gotten to the end of the rules. It's like a 25-minute story, but it makes me smile every time I listen to it, and I'm usually asleep within a couple, 8 minutes or less.
That is
Beautiful.
perfect.
Yeah.
Yeah.
That's a good amount of time to get to bed too, Kate.
That's
Yeah.
I have a friend that prays through the alphabet. He starts on A and then prays, and he said the poor people who begin with Z or XYZ, they never get prayed for because he's always asleep.
Oh, that's good.
Well, in closing, everybody, we sure want to again thank everybody for coming on tonight. I think for me, the takeaway is that with all of the people that are on the call, everybody told about something different for them. It's individual for all of us. And so the reason that we're offering this sleep assessment and the opportunity to get in the sleep transformation program group is simply because it literally looks different for every person. We had people mention that they have limb movements. We had people mention that they have nightmares. We had people mention they have to get up and use the restroom, et cetera, et cetera. And the bottom line is we're all individuals and we're all different. And so typically in getting down to this, it all boils down to the root cause. And, there might be two of us that are both waking up at, 2 a.m, but the root cause for us to wake up at 2 a.m. may be completely different. And so that's why we really want to just have a quick 5 or 10 minute conversation with you to help, because then we can start to peel back those layers of the onion and get down to what the root cause might be, and then what might be a good fit for you to help solve this problem. Maybe it's doing something with us, maybe it's a medical issue that needs addressed with your doctor, et cetera. But we can kind of tease some of those things out with a quick conversation and figure out what the best way to go is for you. And then just tagging on to what Karen was talking about, we're going to be starting the first week of October with our sleep transformation group, is when the next one begins. It is going to be a very small group, 6 to 8 people max, and we do expect it to fill up. So we'd love you to fill out the sleep assessment form anyway, just for your benefit and your educational value. But then if you're interested in the program, also fill it out. And there's opportunities there. We have some people that currently are in a program and then they're doing just that sleep transformation program. We have some people that are doing a combination of that as well as some coaching with Karen, or we have some people that are doing that in combination with a little physical therapy, whatever the case may be. But the point being is it looks a little bit different for everybody. And so we want to try to make sure we fit square pegs and square holes and get the right fit for you as an individual, because this really is an individual problem. So we've got the link there, and then I'll also be sending you out an email that has the link in it as well, for everybody that is either online live or watching the replay. And then my challenge to everybody that's watching is my question for you would be, what do you see is at risk for you if you don't solve your sleep problem? Because so often we have people that end up in our office and they've let this go on and on and on. And so health has started to deteriorate, and then it becomes a little bit of a harder thing to fix. And so what we don't want is you to just watch this webinar and go, oh, gee, this was really interesting, and then turn around and walk away and do nothing about it. We really want all of our patients to have wonderful, healthy, beautifully fulfilling lives. And this is one step to take towards that. And so we just encourage you, if you have any interest at all, there's no obligation. You're not signing up for anything tonight. You're not committing yourself to anything tonight other than just to have a quick conversation with us and learn more about your sleep patterns by filling out that sleep assessment form. So we definitely encourage everybody to do that. And then, as always, if you have questions for us, always feel free to reach out. We're at bodyworxphysicaltherapy.net, and our phone number is 316-558-8808. And yes, we still like to talk on the phone, and you won't get 12 phone trees if you call us. So we appreciate everybody being on board tonight. So thank you, everyone. We'll let you go. And until next time, keep clued into your email. We'll let you know when the next one's coming up. And we'll see everybody next time.
Okay.
Bye, everyone.
Thanks, everyone.
Thank you.
Thank you.